The younger you are when you have the injury, the more likely you are to require surgery. So typically in teenage knees, you will definitely require reconstruction because your knee will remain unstable. But as you get older, especially if you hit 50s and 60s, then it's a different injury and treatment is often conservative. Quite a large study, prospective study looking at these has shown that probably 1/3 of people can manage their symptoms quite well without surgery, and 2/3 of people remain symptomatic and require surgery. The surgery generally very successful, but the rehabilitation period is long. You can't cut any corners. It's 12 months. You have to take the time and do it properly. As with most surgery, you'll often get worse before you get better. So, especially with knee surgery, the quadriceps, the hamstrings will waste away quite significantly for a few weeks. The other thing to realise is that it's your own tissue that we use. So we use one of 3 grafts. Typically in Australia, it's hamstring graft, either single or double hamstring. And the second one is in heavy contact athletes who might use a Patellar graft, especially if you're a rugby player or American football typically. And then thirdly, occasionally use a quadriceps graft, a quadriceps tendon graft. Those are generally the most successful grafts because they're your own tissue, but at the same time we're taking tissue from elsewhere to fill a defect. That's what's called a reconstruction. We're not repairing the ligament, we're reconstructing it, which means we take tissue from elsewhere to use, and therefore that tissue comes at a price. So you have symptoms from where we take it from as well as from the surgery itself. And unfortunately, sometimes where we take the graft from is more painful than the operation itself. So people often complain that their hamstrings are uncomfortable for a few weeks, which you can imagine. But the reason we take the hamstrings most often is because the hamstring regenerates and it has a low comorbidity. So whilst it might be uncomfortable to start with, it's often a better graft in the long term.